Per exam questions and answers with explanations, 30 essential questions. Question 1. A nurse is documenting in a client's chart. Which entry is the most objective? Client is having a bad day. Client appears angry. Client shouted, "Leave me alone," and slammed the door. Client is uncooperative. Objective documentation describes observable behaviors and direct quotes. Question 2. What is the first step in the nursing process? Planning, assessment, implementation, evaluation. Assessment is the first step, involving data collection. Question 3. Which vital sign should be reported immediately? Temp 37.0C, BP 120/80, pulse 110 at rest, respiration 16. A pulse of 110, tachycardia, at rest is abnormal and should be reported. Question 4. The nurse's primary role as a patient advocate is to follow all doctor orders without question, protect the patient's rights and wishes, help the family make decisions, administer medications on time. Advocacy involves supporting the patient's decisions and protecting their rights. Question 5. To ensure patient safety when leaving a room, the nurse should leave the bed in the highest position, lower the side rails completely, ensure the call bell is within reach, turn off all the lights. The call bell must be reachable so the patient can request assistance. Question 6. Before feeding a client with dysphagia, the nurse should lay them flat, check for a gag reflex, give them a straw, hurry the meal. Assessing the gag reflex and swallowing ability is crucial to prevent aspiration. Question 7. The right to confidentiality is protected by which act in Canada, specifically Ontario? HIPAA, FAPA, CNO Act, Health Act. FAPA, Personal Health Information Protection Act, is the relevant legislation in Ontario. Question 8. Which is an example of negligence? Performing a task within your scope, forgetting to lock the wheels on a wheelchair, causing a fall, refusing an unsafe assignment, documenting a medication error. Negligence is the failure to provide the standard of care that a reasonable person would provide. Question 9. When moving a client up in bed, the nurse should bend at the waist, keep feet close together, use a friction-reducing sheet, pull with the back muscles. Using a draw sheet or friction-reducing sheet prevents skin shear and nurse injury. Question 10. A client is on contact precautions. What PPE is required? Mask only, gown and gloves, N95 mask, goggles and hair cover. Contact precautions require gown and gloves when entering the room. Question 11. The goal of primary prevention is to treat a disease, rehabilitate after injury, prevent the onset of disease, provide palliative care. Primary prevention focus on health promotion and preventing disease before it occurs, example vaccines. Question 12. Which is a sign of local infection? Fever, malaise, redness and swelling at the site, increased white blood cell count. Local infection signs are localized, redness, heat, swelling, pain. Question 13. The correct position for an enema administration is right side lying, left Sims position, prone, Fowler's. Left Sims allows the solution to flow by gravity into the sigmoid colon. Question 14. A client is grieving a recent loss. The nurse's best response is, "Don't worry, it gets better. I know exactly how you feel. Would you like to talk about it? You should be strong for your family." Open-ended questions and active listening are therapeutic. Question 15. When performing hand hygiene with soap and water, how long should you rub? 5 seconds, 10 seconds, 15 to 20 seconds, 1 minute. Scrubbing for at least 15 to 20 seconds is recommended for effective hand hygiene. Question 16. Which pulse site is used during CPR on an adult? Radial, brachial, carotid, popliteal. The carotid pulse is the most reliable site to check for a pulse during adult cardiac arrest. Question 17. Standard precautions should be used for only patients with HIV, only patients with MRSA, all patients, regardless of diagnosis, only patients in isolation. Standard precautions apply to all patients to prevent transmission of pathogens. Question 18. What is the normal range for an adult respiratory rate? 8 to 12, 12 to 20, 20 to 30, 30 to 40. The typical normal range for an adult is 12 to 20 breaths per minute. Question 19. A primum non nocere principle means do good, do no harm, be fair, tell the truth. Non-maleficence means first, do no harm. Question 20. What is the purpose of a living will? To distribute money, to specify medical treatments desired if incapacitated, to appoint a lawyer, to name a guardian for children. A living will outlines a person's preferences for end-of-life medical care.